For today, we're reporting on 3 periods. From Friday to Saturday, we had 68 people diagnosed with COVID-19. Between Saturday and Sunday, we had an additional 125 people diagnosed with COVID-19, and Sunday to today, another 74 cases, bringing the total for the weekend to 267 cases, new cases, 10 of whom were epidemiologically linked, bringing our total in British Columbia to 8,908 people with COVID-19, including 3,226 people in the Vancouver Coastal Health Region, 4,555 people in the Fraser Health Region, 206 people in the Vancouver Island Health Region, 531 people in the Interior Health Region, 303 people in Northern Health, and 87 people who normally reside outside of Canada. We are now at 1,302 active cases in the province in all health authorities, and we have, of whom 69 people are in hospital, 22 of whom are in critical care or ICU. And that includes 32 people in hospital in Vancouver Coastal, plus 1 person who is from outside of Canada, 30 in the Fraser Health Region, 1 person in Interior Health, and 5 people in hospital in Northern Health. We unfortunately, sadly, have had 3 new deaths from COVID-19 over the past weekend, bringing the total number of people who've died from COVID-19 to 233. And these are 1 person each in the Fraser Health Authority, Vancouver Coastal, and on Vancouver Island. And as always, we are affected deeply by these deaths and by the families and the caregivers and the communities who are suffering and grieving, and we send our condolences to you. There are 3,372 people now under active public health monitoring and 7,346 people who have recovered from COVID-19. Over the weekend, we've had 3 new healthcare outbreaks. One recurrence in the Holy Family Hospital in Vancouver Coastal Health, Neighbourhood 1 and 2, with a single staff person, and a single staff person as well at Thornbridge Gardens in Fraser Health and Harrison West at Elm Village. The outbreak at Burnaby Hospital, on the other hand, has now been declared over, leaving us with 16 active outbreaks in our healthcare system, 837 total cases, 494 residents, and 335 staff. Additionally, we have 1 new community outbreak that's been declared in the Interior Health Region, with 5 cases related to an event at the Calvary Chapel Church in Kelowna in Interior Health. I would also encourage people to check health authority websites for alerts and notifications. And I do want to make the point that all health authorities now are consistently posting any school exposures, and we can be confident that they are posted up there so that everybody knows where these exposures events have happened. I know, like me, many people would like to see the number of new cases and clusters go down, particularly as we watch what is happening across the country and around the globe, as increased in cases are happening in many places. We can all influence that. Contact tracing has shown that the main source of COVID-19 transmission in British Columbia now continues to be through events where we're socializing with others, whether in a private home or a less controlled setting. We know that important ceremonies, important events like weddings, birthdays, funerals, and parties have been driving this in the last few weeks. What this means is that through the choices we make, we can control the course of the pandemic as we're moving into the fall. Whether the curve goes up further, stays the same, or goes down relies on us. The best thing we can do, all of us, is to take a step back from our social interactions right now. I'm asking you to travel less, to see fewer people, to stay with your household and your safe 6, and connect with others, the other important people in your life, virtually. You can make a difference by making these safe choices now in how you spend time with others. We need to remember to go back to our standing together by staying apart and connecting virtually. We do know that we can make a difference, and we need for our community health and wellness to continue to have our businesses going, to have people going back to work, and to have our schools open. And all we have to do is look around at the many, many places that are doing this and doing this safely to know that we can do it as well. We've shown that by using our layers of protection, whether that's plexiglass barriers, whether that's reducing the numbers of people in a grocery store line, whether it's having those barriers and distance in place in restaurants, can keep customers, colleagues, and our communities safe. Let's take a moment to appreciate this and recognize that we have many things open in our community now, and we can continue to have our communities functioning safely as we go into the fall if we all take a step back and do our part. We need to appreciate these shared successes and use that to energize each other in the months ahead. It isn't always easy to say no to seeing friends or family. We know that. We know that we are social creatures, and having that social connection is important for all of us. It can be a difficult choice to make. But if you see family or friends putting themselves at risk, we need all of us to encourage and support people to do the right thing right now. Here in BC and many other places, we have seen examples of events that we call super spreading events, where somebody passes this virus on unwittingly to large numbers of people, and they can take it home in turn to others. We don't know all of the details around it. We do know that it's most likely to happen when we have large numbers of people who are in close contact, whether it's sharing food and drinks and kissing and hugging or talking loudly, singing. Those are things that we know can transmit this virus even when we're outside, but particularly when we're inside enclosed or crowded spaces. And we do know that sometimes some people are more likely to shed a lot more of the virus than others. And we don't understand yet why some people do and some people don't, and we can't always predict ahead of time. So we do know what we need to do to protect ourselves. We have seen our way through this pandemic, and we can do it again. That includes making sure you know when you're making your decisions whether or not to see others, take a moment to think. Think about the risks you're going into and the risks that you'll bring with me if you do leave, when you do leave. This week, I invite you to join me and take a moment to reach out to the seniors and elders in your life, your friends, and your loved ones who may be at risk. Let them know they are not alone, and in the weeks ahead, show them you care by staying connected to them virtually this fall. Living with COVID-19 is about finding that balance that will keep our communities strong and everyone, whether at school, at work, or at home, as safe as we possibly can be. Let's keep our communities healthy and strong by staying small, staying home, and staying safe. And of course, let's continue to do it by being kind to each other, being calm, and being safe. Thank you, and I'm happy to take questions.